In 2020, the state of California had the second highest amount of reported rape cases with a total of 13,449 cases. When I was 12 years old, I finally admitted to being a sexual survivor. Even after I admitted it, I was questioned and called a liar by those around me. I was one of the lucky ones where my assaulter actually admitted to his own crimes, but for many women, they have to face a huge financial burden in order to get proof of their assault. 1 in 4 people have been victims of some type of sexual assault, meaning we all know someone who has been affected by this. Due to my history, I have done extensive research to advocate for sexual assault survivors. The federal government needs to create stricter guidelines on the Federal Violence Against Women Act to ensure that no victim should pay for their own rape kits. Here before you see the top 10 reported rapes within the United States in 2020. First, I'm going to talk about the history on the Violence Against Women Act. Then I'm going to inform you on rape kits. And lastly, I'm going to talk about the opposing views and why they are flawed. Now I'm going to talk about Violence Against Women Act. In the 1990s, the National Network to End Domestic Violence was formed by a small group of survivors advocating for federal laws regarding domestic violence. As time passed, this group began to grow, and around 4 years later, it became an alliance of domestic violence shelters, programs, and statewide groups. In 1994, it led to the passing of the Violence Against Women Act by the then authored Senator Biden. The Violence Against Women Act creates and supports comprehensive, cost-effective responses to domestic violence, sexual assault, dating violence, and stalking. In 1944, the Violence Against Women Act required states to provide free sexual assault forensic exams in order to get its crime prevention grants. It was amended in 2005 to clarify that victims do not have to report their rape in order to receive the free medical exam. And it was again amended in 2013 to ensure survivors can't be made to pay out of pocket, even if they would be reimbursed later. The VAWA requires that all exams at minimum include an assessment of physical trauma, a determination of penetration or force, a patient interview, and a swabbing for evidence. But it leaves it up to states to decide where the money comes from. With other violent crimes, victims are not responsible for paying for the damage that results from their crime. Many people know that sexual assault is an issue, but they are often unaware that victims are made to pay for associated medical charges. Tennessee of the Medical University of Southern California in Charleston found that victims are made to, with private insurance, are often made to pay on average around $950 or 14% of the cost of medical service, and insurance providers pay around $5,789. However, hospital billing procedures often include more services than just associated with a rape kit. In Tennessee's research, she found overall about 88% of 1,355 victims incurred charges on the day that they visited the hospital, and 27% paid more than 25% of these costs. 7% paid more than 50% of the cost, and after visiting the hospital, 63% of patients incurred more charges up to a month after the incident, including prescriptions, further medical care, and mental health services. In November of 2019, New York Attorney General's office announced settlement with 7 hospitals that had illegally charged more than 200 patients for medical forensic exams. These medical exams cost anywhere from $46 to $3,000. In some cases, the hospitals even referred the individuals to bill collectors who done them for payments. Michelle Andrews, an award-winning journalist, found, and yet despite federal and state laws, government investigation, and countless media reports uncovering wrongdoings over the years, sexual assault victims nationwide continue to be routinely and illegally billed for their rape kits. It is estimated that there are currently well over 100,000 untested rape kits in America. And the backlog defines an untested or backlog rape kit as one that has not been sent to an accredited crime lab within 10 days of collection, or as one that has not been sent to a crime lab within 30 days of receipt. And although these definitions speak in terms of days, it is well known that kits have not been tested for 3 to 5 to or even 20 years. So even after paying for your rape kit, it may end up being backlogged and still remain unsolved. Now I'm going to talk about why this issue has not been solved and what the opposing views are. Many will try to say that our current system works, but this is a fallacy used to save money for the government. In some cases, government officials actually and hospitals willingly defy the law. In 2008, when Sarah Palin was running for vice president, news surfaced that during her time as mayor of Wasilla, Alaska in 2000, the town openly disregarded a state law preventing victims from being billed for rape kits because it was a burden on the taxpayer. Yet, 34 states use victim compensation funds, 11 draw from law enforcement or prosecutorial funds, and a handful of others leave it to individual counties to select a funding source, create special funds, or take it from their human service departments. So these bills don't really burden the taxpayers. In other instances, however, the reason the victims are billed is just clerical errors. The results of untrained hospital staff who improperly file paperwork, use the wrong billing code, or otherwise fail to correctly identify the patient as a survivor of a crime whose bill should be sent to victims' funds. We already have the necessary laws in place for once. That's not the problem. What we don't have is enough consistency among hospital systems to guarantee rape kits nationwide are treated with respect, dignity, and they deserve. These laws are in place for a reason, and we need better training to enforce that these victims get the help that they deserve. This system is a breakdown. This is not a matter of one or two rogue employees. The challenges facing these survivors are part of a larger system of discrimination and really a manifestation of a culture of male supremacy in our healthcare system and as our nation as a whole, is what Schneiderman, the Attorney General handling New York investigation on these rape kits, told reporters. 6 months later, Schneiderman resigned as the Attorney General after 4 women actually accused him of rape. Now I'm going to tell you about what we can do. On March 17, 2021, the U.S. House of Representatives passed H.R. 1620, the Violence Against Women Reauthorization Act of 2021, with a bipartisan vote. And we urge the Senate to introduce and pass a robust bipartisan VAWA this year that builds on the House passed bill. The Violence Against Women Reauthorization Act of 2021 reflects the input of many of the priorities of the domestic and sexual assault movements. This support avenues to justice that focus on victim autonomy, agency, and safety, including restorative justice practices, investments in responsive beyond a criminal system approach, and expand access to the VAWA-funded legal system for survivors, while investing in prevention via the Rape Prevention and Education Program and VAWA Department of Justice Prevention Programs. Now, in conclusion, survivors are forced to handle the financial burden of rape kits even when they are fair. The federal law is against this. We must stand up and tell these stories while supporting the VAWA movement, while urging the Senate to follow the House in passing a stricter bill. 13,449 victims reported their rapes last year. Imagine how many more could feel comfortable reporting if they knew that they could get a free kit without having to worry about their medical bills. Thank you for listening.